Yeah. Let me see. Well, like instead of like $80 like no, you can play with the $80 and the nice ones.
All right. Hey, I want to welcome everybody very much. And you know, one of the things I like to do is I like to do the pledge. So, Representative, would you mind leading us in a pledge? And we're going to start.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So welcome to the Subcommittee on Alzheimer's Disease and Other Related Dementia. Thank you, everybody, for showing up. We appreciate it. And I think, first of all, we'll start with a roll call, and we'll start from our right. And if you wouldn't mind putting on your mic, just press your little red button. Yeah, that didn't work. There you go.
Here we go. Would you like me to do that
Yeah,
again? Maria Camerlengo from Silverthorne Adult Day Center.
Maureen Murtaugh, the Board of Nursing.
Jay Gupta from Harbor Homes in Nashua, New Hampshire.
Jessica Eskelin with the Alzheimer's Association.
Senator Kevin Abard, District 12.
Representative Erica Leon, Derry, Rockingham, 13, I think now.
Hi, Wendy Altman, Department of Health and Human Services.
Hi, Kathy Harvard. I'm from Hanover. I'm a caregiver and work closely with the Alzheimer's Association as a volunteer.
I'm Janessa Luke. I'm a Director of Social Services at Bedford Nursing and Rehab Center.
All right, just for all our comfort, we can do this. Watch this. Just like that. And then we, there you go. And it's your own personal microphone. So, ladies and gentlemen. So, welcome to the committee, and we appreciate you all being here. We know that this hasn't been going on for a while, so we wanted to reestablish it. And so, I think our first order of business is we did the roll call, member introductions. We need a clerk. Does anybody want to be a clerk?
I'm happy to be.
So all in favor of Jessica becoming our clerk? Aye. Any opposed? Seeing none. Welcome and thank you for volunteering, for being part of that. And as our clerk and seeing how you know a lot about this particular topic, would you mind giving us basically a little history of the subcommittee and any kind of updates that you feel are relevant?
Yeah, absolutely. Thank you. So, as the Senator said, this subcommittee was established legislatively in 2014 and met for a while, stopping in about 2018. There was some staff turnover in my role, and for various reasons, meetings sort of dropped off. I've been with the association a little over a year now and really prioritized reconstituting this. I think given our rapidly aging population, the anticipated 23% increase in instances of Alzheimer's and dementia in the next 2 years in New Hampshire, this was really something that merited doing a deep dive on and having a subcommittee be meeting on. So that's why we're here today. In the packets in front of you, I included sort of a master doc, just providing the establishing legislation, some of the history of the subcommittee, the statutory charge, which is listed under membership and scope of work, and then some previous subcommittee activity legislation that the subcommittee had spearheaded in the past, which was really important and is proven very successful in the state. So I just wanted to provide that background and context and really thank all of you for your willingness to serve on this reconstituted committee. I think it's really timely and important, and I look forward to the work we'll do.
Thank you very much. And basically the scope of our discussion per statute.
Yeah, so the scope, again, it's in that document under membership and scope of work. It includes reviewing other states' plans for Alzheimer's disease. Every state has an Alzheimer's plan. Ours was last updated by this subcommittee in 2015, so is certainly out of date and is something I'd like to prioritize updating. Survey individuals with Alzheimer's to more accurately estimate the number of people with this in the state. Study existing services and resources, including but not limited to type, cost, and availability of dementia services. dementia-specific training requirements for long-term care staff, quality measures in care settings, capacity of public safety and law enforcement to respond to people with Alzheimer's disease, availability of home and community-based resources for folks with Alzheimer's, and respite care to assist families and caregivers, inventory of long-term care, dementia care units and beds, adequacy and appropriateness of geriatric, psychiatric units for folks with behavioral disorders associated with Alzheimer's and dementia, assisted living residential options for people with dementia, state support for Alzheimer's disease research through New Hampshire universities and other resources, determine state policies and responses necessary to provide clear and coordinated services and supports to persons, families, and caregivers living with Alzheimer's, and develop strategies to identify and address any gaps in service. And as I mentioned, establish a New Hampshire state plan for Alzheimer's and other related dementia as approved by HHS Oversight, which of course we are a subcommittee of. And in your packet, I did include the most recent updated report, again from 2015, that the subcommittee had done at that time.
Thank you, thank you, thank you. So, I was talking to Jessica earlier, just offline, and, just this previous election, I'm walking down the street with my dog, and I ran into a neighbor, and my neighbor said, "Hey, you're Senator Abar." Hey, yeah. And we got in a little bit of conversation, and his wife was standing right next to him. And he said, we were just talking, and he says, "By the way, my wife has dementia." And I was just kind of floored by that. I really was floored by that because, we saw her crying in the yard this summer, and we thought nothing of it. Well, she was just picking up some weeds, and we was just crying. And apparently, she has an advanced stage of it. Another friend of mine, he's about 85 years old. He was just diagnosed with early, stages of it. So it's, I know a few people. I clean for a living, and so I walk into people's homes, and oh, by the way, my mother, or oh, by the way. And I think one of the common themes that a lot of people are struggling with is the fact that it's almost like you're by yourself. Right? It's like some people like to talk about it. Some people don't like to talk about it. Most people don't. Years ago, if you had a special needs individual, they were kind of like hidden away back then until people found out that there were resources. And I think the same kind of spirit goes on with dementia. It's a private thing, and that being said, what happens is people suffer in silence, and I think one of the things that we can do with this committee is definitely make awareness. What are the resources, and how can people find these resources? And I think that's the important part. I hate committees that don't do anything, that just come and meet. I want to come up with some solutions and something that we can legislate, or we can help facilitate some remedies to help our population. And like Jessica said, got a 23% increase in dementia across the state. And I hear that New Hampshire is one of the most aging states in the union. So that being said, we got our work cut out for us as far as making resources. And I think part of making that known is our elected officials really, they get busy, and they hear sound bites just like everybody else. So our job will be to, make them aware, I think, in ways that they can have a plan of action. And that's one of the things I always look for is everybody in this room is a heck of a lot smarter than me. All I know is how to connect the dots. They put a pretty face, and that's what I am. Just kidding. But I think one of the things I really would like to see are ways to being effective other than just being a committee. So, and everybody's welcome to add to that. Enough about that. But now, if I could just get a little bit of background, everybody introduce themselves a little bit. But can I start with you a little bit? What's your story?
What's my story? Well, I started off as a kindergarten director and ended up as the director of an adult day center where people have dementia. But there's quite a story going on right now. I don't know if you've heard, but 3 of the adult day centers in southern New Hampshire are closing as of November 30th. So I have been spending my last week or so answering phones that are ringing off the hook, trying to place the people. It was senior class in Hampstead, which is the closest one to me. I'm in Salem. So we're trying to fit all of the people from that program into our program. And I maxed out as of this morning, so I'm starting a waiting list. Most of the people that were in my program, so I was averaging about 15 a day coming back from COVID, and my numbers didn't really get up to pre-COVID numbers as of yet, but they've surpassed that now. But most of the people that we had in our program had dementia. I had a couple of people there for physical reasons primarily, but almost everybody had dementia. The population that I'm getting from Hampstead, they're a little bit younger, and not everybody has dementia. They're there for physical reasons. So it's going to be, it'll be day to day. We're going to figure this out. And, but there was an article in, I think it was the Union Leader and they quoted a woman from one of the other places that closed saying that she couldn't find a place that took Medicaid. We do. No, so Medicare, this is my pet peeve. Medicare does not cover adult day. They'll pay to go to a nursing home when the time. So all of our people have to be nursing home eligible to get into the program. So all of the people that come to my program are eligible to be in a nursing home. And if they run out of money, Medicare will kick in and pay for that. But they don't pay for adult days. So the only people that can afford it, because we were at 95 a day, and we're a nonprofit, and that's still not breaking even at the numbers that I had. At 30 people a day, I'll break even, I think. I hope, but without raising the rates too much. But it's $100 a day. So we have a new administrator. She says, well, we're the only game in town. Why don't we raise the rates a little bit? I said, because these are people with Alzheimer's, and if they're coming 5 days a week, they're already paying $2,000 a month out of their pocket. Oh, that's a lot of money. So it's expensive. It's expensive to run a good adult day program. It's expensive to run a lousy adult day program. They're just expensive to run. Right now we're in a bind. So the people that run those programs, there's still Easter Seals in Manchester, which is another big program, and there's one out in the seacoast, there's one up north, but we're kind of in a crisis at the moment.
So that needs to be discussed, obviously. Wow.
Yeah.
Maureen? It's Maureen, right?
Yes, Maureen.
I said, what's your story? Because I forgot your name and I couldn't read it from here.
Oh,
Thank you, Maria. I apologize, Maureen.
that's okay. I'm Maureen Bertok from, I was appointed to the Board of Nursing. Been on there for a couple of years now. I teach LNAs, and I've been teaching LNAs since 2010. And I have watched the program go from 60, my first class that I taught LNAs, the theory was 100 hours plus the 60 hours. We're down to 40 hours is what the state says, because we've gone with the federal instead of what the state has always said. And I'm watching them cut corners, and I've seen them cut corners on dementia care. And I would love to have a whole section, just a whole section on dementia care. That there's no way you can do this whole thing in 40 hours of theory. You can't do it. So we have started, we got a grant last year, and it's taken us quite a while. It's a program between Dover Adult Learning Center and Dover High School CTC. And we started this program. It's for LNAs, and it's for English as a second language is the majority of our students that have had healthcare in other countries that have come forward here with their background. And I thought it was gonna be more of a challenge than it is. It's a fabulous program. I thought I was gonna be pulling my hair out of my head. I love it. The background that so many of these people have. We have so many people from other countries in this state that have background in healthcare, and we need to get them.
Yep. Yep.
That's my thing.
Who's the main counsel? Yeah. Do I call you doctor?
No, I can play one on TV if you want.
You need a white coat for that.
Well, I'm just a drug dealer from city of Nashua. So a couple of my family members have been struggling with Alzheimer's. But as a pharmacist, I know we have not really succeeded in conquering this disease. We have less than 10 drugs, not very effective, just symptomatic relief mostly. What I really am passionate about personally is non-pharmacological interventions. I've been teaching yoga and mindfulness. I've traveled and talked in more than 40 states. I do CME, CNE events, just teaching healthcare providers how to de-prescribe medications. I also believe in healthcare, we fail. We are notorious in failing consistently in finding out what is the root cause of the problem. And we don't fix the root cause.
It's sugar.
So if somebody has strep throat and they have fever, we don't just give them Tylenol, we also give them antibiotic. But when it comes to dementia, hypertension, diabetes, everything, we are just treating the symptom like treating the fever, but without fixing the root cause. So just this morning, I was reading from CNN that PPIs, the proton pump inhibitors, available over the counters. People are definitely overusing that category of medications, has 33% more possibility of causing dementia. So different mechanism of action. So really, this is what I'm passionate about, figuring out what is causing the root cause, what is the root cause of the problem, and fixing that. Medications, of course, that's my bread and butter, literally. I make money by selling drugs, but de-prescribing is something which we really need to focus on.
You said de-subscribing.
De-prescribing.
Prescribing, yes.
So that's what I teach in medical schools, in nursing programs, and pharmacy, of course. Yeah.
Thank you. Thank you. We already heard from you.
Jess Eskeland, I'm the Senior Public Policy Manager with the Alzheimer's Association, been here a little over a year. And I'll just say that anecdotally, in the short time I've been at the association, I have yet to meet someone and share what I do that hasn't been touched in some way by this disease. I was telling the senator that. So thrilled to be here and learn and work with you all and see what we come up with.
Super. Representative?
Thank you very much. My name is Erica Leon. I'm a representative from Derry, and I volunteered to join this because I thought we'd have a significant amount of time with my father-in-law dealing with finally getting him diagnosed with Alzheimer's. He ended up passing this past September, but the experience watching his resistance to any sort of diagnosis of dementia or Alzheimer, the resistance to planning, the resistance to doing anything that would acknowledge that he had this disease that was going to progress was a serious challenge. And as family members, we've dealt with the experience of not having any of those sort of surrounds where there might be some way to notify the local police that I believe he has dementia, he hasn't been diagnosed, we're doing as much as we can to provide for him, but he doesn't want to accept it because he has dementia. And to figure out how we can build more of those supports so those people who want to help, but by respecting their autonomy and the fact that they're able to make those decisions, it's their right to refuse that help. help, but to make sure that when that time comes for help, they're ready. And also just looking at that whole process of trying to destigmatize it, because it is common. So many people deal with this. You know, we actually stigmatize way too many diseases, actually. I was going to say high blood pressure and diabetes, but no, people point to what you're eating, even though that's not always the root cause. But to figure out some way that we can do that, and even, you know, my pipe dream would be to figure out some way to have some sort of transition plan, not where somebody could voluntarily go from managing all their finances to putting into place a voluntary shift of responsibilities as their condition progresses, so that while they're able to talk about what they want and when they would want to have help, you know, there's some sort of a contractual process that they could enter into with their family members and their caregivers and figure out how to have that oversight. And, you know, not something anybody would be forced into, but at least if we had a pathway that you could choose to participate in, I think it would help smooth that pathway. And after discussing this in the community, there's so many people in Derry that have reached out to me and surrounding areas, trying to get their family members, trying to get their neighbors. You know, I just had one of the teachers at my kids' co-op say they had a neighbor who they're trying to figure out where to place them because she's walked out of the house too many times. And they're worried if she does that in winter, they'll lose her. You know, it's an issue where we need to figure out how to address it. And, you know, I'm not here for the easy solutions because those things have already been done. I'm here to work to get to the hard solutions for the things we need to do.
Thank you, Representative. Wendy?
Hi, everybody. Again, Wendy Altman. I'm the Bureau Chief for the Bureau of Elderly and Adult Services within the Department of Health and Human Services. I guess I'll touch on from a personal perspective. I have had many experiences right from high school, going to LNA school or CNA school back then. 25, 30 years ago, well, probably 30 years ago now. And so I've worked in the field, I've worked in home care, I've worked in direct care as well as day rehab for people with disabilities in nursing home settings, and then started working with the Department of Health and Human Services, where I transitioned more to a policy program role, and have been with the department for 25 years now, in various roles. One of those being the administrator for our Aging and Disability Resource Centers, where we've built that program to align with federal initiatives and programs for Older Americans Act services for caregiver support, and funding that we receive from the state for Alzheimer's disease and related dementias to provide education, support, and respite to family caregivers who want to receive respite or need supplemental help and education and support from their peers. And we've also built and oversee programs within the Bureau, such as the Choices for Independence Medicaid waiver program and Older Americans Act services that support adult day, home care services, home delivered meals, and our adult protective services. So over the years, many experiences, many lenses to the work related to Alzheimer's disease and related dementias. And we've currently built into our state plan on aging that's renewed every 4 years, goals and objectives and strategies related to Alzheimer's disease, related dementia, public awareness, age-friendly language, many things that we hope that will support and build capacity for our service system to help this population and their caregivers and providers in terms of awareness and training.
So is there any legislation as a byproduct of what you just said that that's in the works right now?
I don't think there's any current legislation being filed. We, at the department, we're currently reviewing some of the things that come our way in legislative requests. And I haven't seen anything to date yet. But in the last year's session, we did have a bill that legislated and funded a public awareness campaign for
I hear that
Alzheimer's
was
disease.
a really good bill.
So that was a very good bill.
That was a very good. Thank you very much.
Thank you. Hi. So I'm Kathy Harvard, and I'm here in the capacity of as someone who was a caregiver for many years for my husband, who passed from younger onset Alzheimer's a few years ago. But I accompanied, and my young children, we accompanied my husband on his more than decade-long journey through dementia, and in that process navigated the world of elder support services, the health system. And at that point, we were younger age, I was able to find out at an earlier time exactly what worked and what didn't work. And so I have been involved since that time, doing what I can on advocacy and policy and awareness raising on behalf of the families who are dealing with this. And so you've already touched on so many of it. Let's just start with stigma and let's talk about awareness. Most of the caregivers that I am familiar with will tell you that some of it's self-stigmatizing. We have to change attitudes, and attitudes can be changed by leaders, and we're better than right here. So starting by creating a different kind of conversation about dementia of all sorts, not just Alzheimer's, and exactly what you alluded to. We used to talk about 50 years ago, cancer was the C word, right? We've changed the way we handle all kinds of disabilities. This one has got to be changed just by the sheer numbers that we are dealing with. So keying into public awareness campaigns, which don't cost a whole lot of money, but have huge amount of impact in liberating families to be able to talk more openly. And as we found out now, is that in fact there may be a way to reduce, by risk prevention, to reduce the incidence of dementia by certain brain health messages that our older population needs. But if they won't listen and they won't self-identify to their doctors, and the doctors are not pushing, then we are missing opportunities that are costing us all a lot of money. So I feel that there's both a public awareness side of things, and I personally have been able to participate on a number of policy and legislative changes here over the years that had a direct impact on me. And so I know that singling out those 2 or 3 pieces we can do every year, they will have impact on families. They will make a difference. They will either save money or they will save sorrow, but they will help. And so I think identifying what priorities we can make progress on would be huge. So thank you. The entire system needs to be navigated more openly, and whatever way that we can do that legislatively or through public awareness, it's a very, very pressing need.
Thank you.
So I am Janessa Luke. I'm the Director of Social Services at Bedford Nursing and Rehab Center. I started healthcare in 2010. I was a dietary aide in an assisted living in Massachusetts. Worked my way up and was a BOM and Director of Admissions for many, many years. Something that happened to me personally, I lost my fiance in 2019 to suicide. So at that point, I had an opportunity a little bit after to take over social services in my building. And not only with my own healing did that help me with helping others, I just also have seen such a need for the resources that people need in the community. Just the support, the awareness, kind of what everyone has said. So, I'm here to help. I want to make a change.
Yep. Well, we appreciate you being here. Thank you. Yeah. So I think one of the things that I'd like to see is if instead of having a book, if you can give me some bullet points as to what you would like to see out of this committee. Not a long letter, just bullet points. I want to see some progress on this bullet point or this bullet point or this bullet point, whether it's deeper prescription or we have an issue with, we got some closings and that's going to put a really big burden. So if I can get a list from everybody as to what they want to accomplish through this committee, it would be helpful for us, and then we can zero in on some quick solutions. I'm sure we can go on and on and on. I think one of the things that I'd also like to consider is the living conditions of some of these individuals. Why would I say that? Some of you know that I am a cleaner. I've been cleaning since 15 years old. And years ago, I used to do a lot of cleaning up here in the Concord area. And years back, before any of your times, I think there were some needs up here, right across the way over here. And there was a gentleman, he had Alzheimer's. And the state came up and said, "Would you mind cleaning his house?" The swill that people live in that are abandoned is breathtaking, literally. And I remember going in there and I said, okay, I just want him out of the house for a few hours. Cleaned out the entire house. And they said, you can keep whatever you find. Well, when you see the swill that these people live in, you think, well, I wouldn't want anything. And I cleaned the house, went into the apartment, opened up the kitchen, the cabinet. There was garbage stacked all the way to the top. At the bottom of that garbage was a violin. Now, some of you know I like instruments. So I cleaned everything out. I found the violin and I opened it up. I looked inside the violin case, and the bridge was broken, but wasn't super bad. I thought, wow, this is cool. Maybe I'll keep this. I looked inside, and it said Stradivarius. I closed it. I put it under his bed. I cleaned that apartment, and she brought him back, and he was okay to live in this clean environment. I went under the bed, I took the Stradivarius, and I put it on his bed, and I said, I want to show you something. Did you know you have this? No expression. Yep. Come to find out, he was a World War II vet. I found all his medals and secret missions that he did, and I displayed him on his cabinet and on his bureau. And I walked out of there, and I wouldn't take that. I wouldn't take the violin. It was just too valuable. But I left there thinking, he's left alone. He served his country. Somebody had pity on him to clean this place, but his family abandoned him. Let the state take care of it. And he lived in swill. And I'm going to tell you, there are more people like that than people realize living in the state, because I've cleaned a lot of them. And most people wouldn't walk into some of these conditions. But after a while, you know, that to me, it's so heartless. Where's the family? Where are the resources for this individual? And as precious as that violin was, stacked under that garbage, there was something multiple times more valuable, and it was that soul that lived in that swill. And I would like to make sure that we can at least consider, you know, also some of the living conditions and resources for individuals that you'd be surprised what you get used to. You'd be surprised. I'm sure you've seen it. I'm sure you've seen it, some of you. But I definitely want that into consideration because it's subhuman in some of the things that these people live in. But with that, I would definitely like to see some bullet points. I'd like to see some solutions, some plans of actions. And if there are amendments that we can attach to any piece of legislation that would solve a certain crisis, let us know. I mean, let me know, because we're past the gauntlet now as far as legislative putting in things, but I am the chair of rules. So I don't But we can also always attach an amendment to something if necessary. So with that being said, um, that's your homework, if that's okay. And I guess we're coming into the holiday season, so I think one of the things is to schedule the next meeting. And if you have some things that we can bring present to the next meeting, that'd be great. If we can do one more before the end of the year, let's agree on a date at some point. If you're all in favor.
Do we
of
know,
doing
sir, do we know how often we're going to meet?
every other week.
Every other week?
I'm kidding.
Oh, no, I thought that was exciting.
I'm so kidding. No, that's supposed to make your heart drop.
No. I think you have a room full of people that are really motivated.
Yeah, and I really want to take advantage of that. And by the way, I want to recognize Tom Praisall for being in the audience as well, who's one of the people that helped me draft the legislation that was mentioned earlier, and Tom and Jessica also. But welcome. Not really, but go ahead. Yes, you can, of course. Yes.
Thank you. For the record, Tom Praisall from Demers and Praisall. I've represented the Alzheimer's Association for the better part of the last decade and was here with the infancy and the foundation of this permanent subcommittee. So, and I just want to say over the years, this working group has put together a lot of great ideas that have become laws, including, creating the Silver Alert program for when someone goes missing. We have worked for training, required hours of training in regards to specific Alzheimer's and dementia, which has really helped with, I think, the retention of those workers because they're not burning out when they are given the tools to properly handle situations. We worked on language to change the definition of Alzheimer's disease to create more eligibility for the respite grant. And I just want to say, sitting back here and listening to all of you, I'm really excited because I think this group can do a lot of great work. So I'm just really looking forward to seeing what you all put out there. But that's all I have to say. I was just itching to say it.
Well, we appreciate that. And if you see anything in the works, in the pipeline that we can attach something to, or, that'd be great. And if there's some grants that we can use for education. The big concern right now, I think, is the closing of some facilities. I think that's one of the things that we really got to, thank you, Tom. We got to really focus on. So let's come up with some bullet points as a plan of action. And I think other than that, our next big thing to do is come up with another date to meet, and we should have all that in advance. Yeah.
May I add to that problem transportation?
Oh yeah. Just
I second that.
Yeah. Put it in the in the bullet points of things for us to look at, and if there are some resources that we have not tapped into, put that in there as well. If there are any rules that are hindering, because things in rules can have let me know, and let's see if we can't make a law to change a rule, because that's how we do it, right?
Actually, I'm on Jocko. We can always ask to have a rule changed, and then if it's appropriate, then they can bring it through the rulemaking process. If they don't change it on their own, then we can pass a law in order to encourage them much more strongly.
Exactly. So that being said, I don't know if we're able to come up with a date now, or
Senator, if it's helpful, I'm happy to connect with Tricia, and
Yeah.
I'll send out another availability poll if that works for folks. Working with her on your calendar.
that works. Yeah.
Okay, great. I'll do that today.
She's the brains of my operation, that's for sure. So with that, I don't know if there's anything else we need to do, right? Other than scheduling a meeting. And definitely come up with something. And I promise you, if it's a book, I won't read it. I just won't. And I think that's one of the things that a lot of senators do. If they see even the longest of emails, unless they are extremely bored, which they're not. So bullet points are usually the best way to get things done with a plan of action. And it's like cutting to the chase. Nobody wants to hear, just get it done. That's kind of how I'm designed, I'm wired. So Any final thoughts with anybody? Anybody want to add anything to anything? With that, is there a motion to adjourn?
So moved.
Is there a second? All in favor of adjournment? Thank you. All right, any opposed? Seeing none, thank you very much. And those name tags that didn't show up, we can keep them included too, right, into the conversation?
Yes,
Yeah.
yep.
All right. Thank you all. And happy Thanksgiving if I don't see you.
I don't think we'll be back before then.
Well, you never know.
You never know.
Thank you, Jessica.